evening, a very good evening. First of all, a quick note whether I'm audible and visible, everyone. Am I audible and visible, everyone? Okay. Happy evening, everyone. A very good evening. I hope and I believe all of you are doing well. So here we are with a new series that we are starting that is called F3 with N3. And what does it stand for and how is it going to help and who is it going to help? So let's quickly discuss about this first and then we'll start discussing about the questions. And also in the today's session, I'm also going to discuss about the INICET test and discussion batch that we are launching on Medsynapse app. So dedicatedly to help the students, to prepare for the upcoming INICET, the students who have given NEET PG 24, already done with their syllabus, but they could not score well, probably because MCQ skills is what is lacking. So that is what we are going to work on, right? So first of all, a quick discussion on what is F3 with N3 is Friday Fast 5. So that, you guys also remember, because even in the series, I like to put those mnemonics so that neither you nor me forget that F for Friday and F for Fast 5 is what you have with N3, that is Dr. Nikita Nanwani Nathani. So Friday Fast 5 clinical MCQs, what is the very reason of starting the series is because I've seen a lot of students who read theory, who need notes, but when it comes to applying the concepts to the MCQs with those 4 options in front, that is where the confusion begins and that is where the performance gets affected. And I know that majority students face this difficulty and that is why we are starting with this. So this is a series where you are going to have a Fast 5 MCQ test. The test will be conducted on the Medsynapse app, the Medsynapse by Dr. Nikita app, and it's going to be a free test for everyone. Every Friday, 5 clinical MCQs like USMLE pattern clinical MCQs, because that is what you are seeing in all the exams, be it NEET PG, be it FMGE also, right, or be it INICET also. So these are going to be free tests and we will be having YouTube live discussions of these. Okay, so just 5 MCQs, 7 minutes. Gradually when you guys become pro, I'll start decreasing the time so that in 5 minutes you do 5 questions. So you only have to take out 7 minutes, 5 minutes on Friday, and then this discussion is going to be there. So where do you find this test is in the Medsynapse app, the home page of Medsynapse app. You would see a tile named test series and in that you would see this F3 with N3 test series, right? After the session is over, so that to make it easy for you guys to revise as well after the session is over, I'll be attaching the annotated PDF to the respective test also, right? So when you want to revise, you will have with each test, you can, whenever you are revising, you can quickly go through the questions, right? And then look at the discussion, the annotated PDF also. Okay? Rishikesh, I'm coming to that. No, Sonal, you don't need to do that. Whatever courses we have in Medsynapse app, basically that comes under one subscription. So you don't have to buy another subscription for INICET TND specially. Okay? 100 questions, Harikesh, that is what I'm going to update about that. Ki what is 100 questions, kahan se aayega, and expert witness or anybody else who's upset with the NEET PG results, ask yourself, do I have an option? like, at my rank I'm getting a branch, or I want to take it, the branch that I'm getting, or do I want to give myself another chance? That is the first question that you have to ask, right? Whatever you do, make sure you are taking your decision very wisely, right, in a calm state of mind, because that is when you'll be able to take a wise decision. Yes, MD Medicine, please watch those. The ones that we had before NEET PG, the mini GTs that we had, they are there in the app. The discussions are available. Similarly, for INICET, we will have that as well. Okay. So, this is the plan, and the first test that we had was today. Right, we are starting with the series today itself, and these are the top 3 rankers so far in the test that I got from the results. So Shashank Yadav, Pratichi and Teja 20 on 20. Approximately 14 students got 20 on 20. 5 questions plus 4 and minus 1. So 20 marks ka question tha. Approximately 14 students have got all 5 correct. And even out of that, these are the top 3 rankers depending on the time also taken. That is also deciding your rank in the app. Okay, so the time taken also decides the rank. When it's the same scoring, it is a time which is taken into consideration. Okay. So heartiest congratulations, the top 3 rankers, and let us see who gets in the top 3 the next time. Right. Now, we have 2 things to discuss. One is the INICET plan and one is the F3 with N3 ka test 1 ka discussion. Okay? Oh yes, Manish, FMG students definitely must attend all these F3 with N3 tests and their discussions. Trust me, you will benefit significantly with these sessions. Okay, they are going to help you a big time. Right. So, let me first tell you quickly about the INICET dedicated timetable that I have planned for you guys. So, in the previous YouTube live session, I had given you a timetable, INICET November 24 timetable, where I had given you starting from 31st August till 15th of October, how you should plan your one read for INICET exam. Now, depending on the same timetable, I have planned this INICET TND for you, and we are combining three subjects here. So, 8th of September, this is mini GT, I'll talk about that later on. 10th September is your first 3 subjects combined together, dermat, physio, anesthesia. So, look at this one, dermat, physio, anesthesia, these 3 subjects, they are ending on 7th of September. We have a test on 10th of September. The next test that you have is on 17th September for the next 3 subjects, that is micro, psychiatry and pharmacology. This is going to be on 17th of September. Then you have medicine, PSM and FMD ending on 24th. You have it on 24th September, right? And not this one. Then you have the next test which comes up. Let me show you in this timetable. That is 1st of October. This is going to be the 3 subjects on 1st of October. Then this is going to be the next 3 subjects. Radio we are not going to have here. I take radiology and prep ladder. So I have replaced this radiology with pathology, one subject which is remaining here on 8th of October. And then on 15th of October, you have the rest of the 3 subjects. Now again, you have another mnemonic trick to remember here. So you can remember this as Tuesday test for INICET. Okay. So it is starting from Tuesday is what I have kept. So 10 September is a Tuesday, 17, 24, 1st, 8 and 15. So if you see, it is Tuesday. So remember, Tuesday is the test, that is tiny test. Okay, Tuesday INICET test. Okay, so every Tuesday you are going to have a test based on INICET pattern questions, INICET PYQs, INICET FYQs, that is future year questions, expected questions that we are going to have, and you have 3 subjects combined. Now the important point here that in the app, the Medsynapse app, in every test you can see the sections also. So when I will put a test for the 3 subjects, at the above panel in the test, you'll be able to see that these are dermatology questions, these are physiology questions, and these are anesthesia questions. So even if you would be giving one test, but you will be able to segregate like the 3 different subjects there. Okay, so that is what is the plan. Tuesday tiny test, that is Tuesday INICET test is going to be there. And then alternate Sundays, okay, the same days in the timetable that I had shared before, which was the GT or the revision days for the students following this timetable, the FMG students. So this is the timetable for FMG and NEET PG students who are not giving INICET, right? So they are completing their first read by 10th of November, okay? And for the students who are giving the INICET, this is your timetable. You are completing the first read here for INICET by 15th of October. Okay. So the break days which are there for the students preparing for FMG NEET PG, I've given you alternate Sundays off. The alternate Sundays off I've given you is for giving a grand test from whatever primary platform you are using. But now we will also be having, starting from 8th of September to 20 October, we are going to have mini INICETs as well, which is going to have 50 questions. Rather than doing one mega INICET GT, which is 200 questions, I'm doing it similar to NEET PG, like we had done mini GTs, so that it's not too much for you and we can discuss also. 50 questions, 45 minutes, that is how you get the sections and the blocks in INICET. Okay, so remember that this is what is going to be here. So you have your mini GTs alternate Sunday, 8 September, 22 September, then you have here 6 October and 20 October. Okay, 8, 22, 6 and 20. So alternate Sundays starting from 8th of September, we are going to start with the mini INICET GTs. The first mini GT that you have, I'm going to keep it as a simple GT, maybe with some one-liners, easy questions also included, because first I want all of you to get that confidence boosted, right? So that you get that confidence boost that at least the easy questions, the simple questions I am able to answer. So that is why particularly the first test, I'll keep it an easy one. So all the students, whether you are preparing for FMG or NEET PG, you also should be giving all these tests. Remember, you have to learn all these skills as well. Okay. Yeah, I've given you these daily targets for the subjects also here, right? For the INICET students, these are your self-study targets that you have to follow. So currently what is going on is, this is today your last day of physiology. So tomorrow you will be completing anesthesia. Okay. Your first mini GT is coming on 8th of September and your first 3 subjects combined, dermat, physiology, anesthesia, that is going to come on 10th of September. Is this clear with everyone? नहीं सोनल, like I said, नहीं करनी है. Medsynapse का जिनका भी subscription active है, whether you are a FMG student, NEET PG student, INICET students, you will get access to this INICET TND as well. This is not a separate course that needs to be purchased separately, right? You just need that one subscription on the Medsynapse app. ठीक है? Understood everyone? So this is the plan. I'll be sharing the timetable on Telegram and Instagram as well, so that you can keep this timetable with you and you can follow the timetable accordingly and you can appear for the test and see how you perform, right? For the NEET PG and FMG students, this live class which is there, these are going to be KBMDs, Kaun Banega MDs, which are live MCQ discussion where you solve the questions in the class itself. For the INICET students, the test will be put beforehand, right? And the test we will discuss on the same days, except for this 8 September test, we are going to discuss it later. Maybe we will discuss it on 11 or 12 September because I am traveling. Okay, clear with everyone? So this is what the plan is for the KBMD which is there. We are doing PYQs KBMD, again including PYQs from FMG, NEET PG and INICET. Okay, we are including PYQs from FMG, NEET PG and INICET in the live KBMDs which are happening for the students preparing for FMG and NEET PG. Okay? Okay, Lakshmi, till 15th of October, this is the plan. What is going to be the plan after that? I'll let you know as the days unfold. Abhi tak itna hi karo. Okay, how to adjust the timetable if starting from Monday? So, you know, you have to adjust it by yourself. These are the targets that I've given you and you have to squeeze in time for yourself, and accordingly you have to appear for the test and assess your performance and learn the MCQ solving skills with me in the live discussion classes. Okay, everybody is done. So this is the live class schedule that I've put here. You have the KBMD PYQ and the INICET test and discussion which is going to happen. So now the first one that you have, mini GT will be live on 8 on September, but this will be discussed on 11-12 September. The first live that you have here is going to be dermat, physio and anesthesia discussion on 10th. Okay, that is going to be on 10th. The 3 subjects, dermat, physiology and anesthesia. Okay, everybody is clear, happy, right? So now let's start discussing the questions of the F3 with N3 test 1. This was the first question here. Right. This is the first question here. I have particularly made the PDF in such a way that the first question is just a question like this, and in the next slide, the same question is where I will write it down, the description or the points for you, so that when you open the PDF the next time, the annotated PDF, you do not see all the khichdi on this question itself written. So first slide you will have the question, and on the next slide is where we write the discussion. Okay. Alright, so let's start. Yes, all the live classes, even the KBMDs or the INICET TNDs, all the live classes will be available as recorded sessions. So if you miss a live class, you can always watch it as recorded class. Okay? Chalo. Let's go to this one here. So guys, when you have lengthy questions like this, always remember you have to start reading from the last line first, because that gives you the crux of the question. So the question is, which of the following nerves is most likely damaged in this patient? That is what I read, and then I see the options, and I see the options are somewhere related to lower limb. So now I know that they are asking something for nerve injury in the lower limb somewhere. So let me have a look at the findings. So when the last line you have read, and then you read the second last line, sensation over the rest of the foot is normal, right? Then you read the line before that. So actually the lengthy question, you start reading the reverse, that is actually time saving. Sensation to pinprick is decreased between the great and the second toes of the right foot. Now is this a giveaway in the question? Without reading the rest of the question, just based on this line, can I answer this question? Yes, because in the foot, the gap here between the great toe and the second toe, the sensation here, this is very, very important question which comes as a one-liner. What nerve supplies here the first web space? First web space, it is deep peroneal nerve. This is just a one-liner frequently asked fact in all the exams, including FMGE exam, which has been put in a confusing question like this. So this is the deep peroneal nerve, and based on this itself, the answer becomes deep peroneal nerve. You should never forget that. This first web space, the sensation is deep peroneal nerve. What dermatome is this? Can someone tell me? What dermatome is that? The first web space of the foot? Next time, if they do not ask you the nerve, they ask you the dermatome, then what is that? Aragni, the test is there in the Medsynapse app, test series section on the home page. There you have this F3 with N3. There you will find the test, and the rest of the test also will be uploaded there in the app. Every Friday, the morning, the test will be uploaded. Chalo, tell me, what dermatome is it? Which is the first web space? Yes. Is it L4? Is it L5? Is it L3? Is it S1? Is it S2? Please remember, this is L5. Okay, important. This is L5 dermatome. Okay, this is L5 dermatome. This is also important. Now, the next question that I have for you is, which nerve causes dorsiflexion? The peroneal nerve or the tibial nerve? Which nerve in the leg causes dorsiflexion? The peroneal nerve or the tibial nerve? What is the mnemonic for that? You remember the mnemonic for that is ped tip. What is ped tip? Peroneal nerve causes eversion and dorsiflexion. Tibial nerve causes inversion and plantar flexion. Okay, inversion and plantar flexion. The exception here is inversion is done by tibial muscles, that is tibialis anterior, tibialis posterior. Out of that, the tibialis anterior is supplied by the deep peroneal nerve. Okay, deep peroneal nerve. So this is a very savior mnemonic that comes to your rescue. Remember, ped tip. So what do you expect in this question when the deep peroneal nerve is gone? Ped tip. So it is the peroneal dorsiflexion. So the dorsiflexion should be affected. That is what is given here. Weakness of the ankle dorsiflexor muscles. Okay, weakness of the ankle dorsiflexor muscles. The everter muscles have full power. Eversion is by the superficial peroneal nerve, the everters which are there. Okay, so remember, the answer here is going to be deep peroneal nerve, and the patient has the foot drop as well because the dorsiflexion is affected. Foot drop, generally the question you get is common peroneal nerve, fracture neck of fibula, one of your last year NEET PG exam question as well. Common peroneal nerve which is injured by the fracture neck of fibula, that will cause foot drop. Okay, that will cause foot drop. Clear with everyone? Right? So the answer here is deep peroneal nerve. Okay, the answer here is deep peroneal nerve. It is not common peroneal. It is not superficial peroneal because the everters are not affected. The lateral compartment of the leg is not affected. It's the anterior compartment, the deep peroneal nerve, which is affected. Okay? Right. Great. Yes, deep peroneal nerve is the anterior tibial nerve because it goes in the anterior compartment. Going to the next question, another interesting question. You are not supposed to make such questions wrong in the exam. So this is the second question here. Again, which of the following is the most likely cause of these findings? Now look at the options. Whenever you are in the exam hall, you are solving a grand test, look at the last line, look at the options because then you get to know that what is this question about. Aneurysm of PCOM, superior cervical ganglion compression, trochlear, scleral venous sinus, so something related to nerve compression related to the eye is what we can gauge from here, right? Now look at this, the visual acuity is within normal limits. When the eyelid is raised manually, the eye is fixed in the out position and the pupil is dilated. Does it give me some clue? Yes. What are the other clues? There is ptosis which is there. So connect the dots together. Ptosis, out position, pupil dilated. What nerve are you thinking about here? Which nerve is injured? When you have ptosis, how is the eyeball? Down and out. How is the pupil? The pupil is dilated. All these features tell you that this is third nerve palsy. Okay, this is third nerve palsy. So the question is about third nerve palsy. You get ptosis in third nerve palsy because the LPS is affected, right? Down and out. Why do you get down and out? Because remember that extraocular muscles all are supplied by 3 except SO4, LR6. Superior oblique by 4 and LR by 6. Superior oblique. Remember, obliques cause opposite action. The name is superior but the action is opposite. It causes depression. That means down going eye. Lateral rectus takes the eye laterally. Lateral is out. And that is why these two muscles are spared here in third nerve palsy. And that is why superior oblique, lateral rectus, it is down and out. Okay, the nerve, the eyeball is down and out. Why is the pupil dilated? Because the third nerve is a parasympathetic nerve, right? It's a parasympathetic. 3, 7, 9, 10 cranial nerves are parasympathetic nerves. And parasympathetic, remember, cholinergic, very, very important mnemonic again, cholinergic, constricts the pupil. Okay, cholinergic constricts the pupil. So that is why there is no pupil constriction happening and that is why there is pupil dilatation. So when you have third nerve palsy, what do you think of? Aneurysm of PCOM, very, very important. PCOM aneurysm is a very important cause of third nerve palsy because if you have a look at the course of the third nerve, it is related to the PCOM and the PCA artery. So you have the PCA and you have the PCOM joining with the ICA. And here goes the third nerve. So aneurysm of this compresses the third nerve, causes its palsy. Now my next question to you is, this third nerve palsy caused by aneurysm, will it affect the pupil or will it not affect the pupil? So when you have aneurysm compressing on the third nerve, remember pupillary fibers, P for P, are peripheral fibers and they get affected. Okay, the aneurysm compresses on that. What says in which condition? Very, very important. AIIMS asks this question very frequently. Where do you see pupil sparing third nerve palsy? Where do you see pupil sparing third nerve palsy? Pupil sparing third nerve palsy, very, very important. Remember, it is seen in diabetes mellitus, very, very important, where this is microvascular ischemia causing the palsy which affects the center and not the peripheral fibers first. the central fibers are affected. So very, very important. Diabetes mellitus is pupil sparing third nerve palsy because it affects the center and not the periphery. The pupil fibers are present peripherally. So if there's an aneurysm coming from outside, that compresses the pupillary fibers and causes pupillary manifestation. Going to the rest of the options, compression of the superior cervical ganglion. Remember sympathetic hai ye, sympathetic wale ka, this will lead to Horner syndrome, which has pupillary meiosis, constriction, meiosis, anhydrosis is what you see here. Damage to trochlear nerve, fourth nerve, SO4 will be affected. The patient will have the head tilt, right? And the patient will have the chin depression. So that is what is going to be with the, and there's going to be hypertropia. Occlusion of scleral venous sinus, that is the canal of Schlemm. This is going to lead to angle closure glaucoma, which is an acute painful condition with a fixed dilated pupil, right? It's an acute painful condition with a fixed dilated pupil. Red eye will be there. It is angle closure glaucoma. So I hope everybody is clear that the answer here is PCOM aneurysm third nerve palsy is very, very important here. Okay. PCOM aneurysm third nerve palsy is a learning lesson here. You should never ever forget this. Okay. You should never ever forget this. Going on to the next question. This is your third question. Another interesting question. This patient is most likely to have which of the following additional findings out of amenorrhea, aphasia, double vision, loss of memory? What do we see in this patient is there is loss of temporal visual field in both the eyes. That is how you try reading the question in between the lines. Because if you try reading from the first, generally the first two lines are the distractors and they are time wasters, right? So you should always read the question in the reverse manner to save your time. Loss of temporal field, when I see this, it rings a bell in my mind that this is something related to cellular, supracellular lesion. That is some pituitary lesion which there is what we are thinking about, right? And when you have this pituitary lesion given, along with the features asked, what will be there? So just based on this, you can mark the answer as amenorrhea because the most common pituitary adenoma that you have prolactinoma. So increased prolactin, which suppresses, which inhibits the GnRH, and that is why it decreases the FSH, LH levels, and that is how it can lead to amenorrhea, right? Prolactinoma, galactorrhea, that leads to amenorrhea. Is this clear with everyone? Right? So this is going to be, the answer here is going to be amenorrhea. Aphasia will be seen with Broca's and Wernicke's, that is frontal lobe and temporal lobe lesions there. Double vision, diplopia, like it may be in refractive errors or the nerve palsy like we have seen. And loss of memory, like hippocampus is affected, the memory wala pathway, that is when there's going to be loss of memory. So this is prolactinoma, right? And that is why amenorrhea will be the finding here. Okay, amenorrhea will be the finding here. Is this clear with everyone? Okay, so the answer here will be amenorrhea. Easy. Going to next one. Okay, another interesting question, but testing the basic concept. Okay, testing the basic concept. Okay. The most likely cause of the increased prothrombin time is damage to which of the following cells? This is a perfect example of question where just reading the last line helps you answer the question. Ki increased prothrombin time is seen in damage to which of the following cells? So first of all, tell me, when does the prothrombin time increase? Is it extrinsic pathway or is it intrinsic pathway? Extrinsic pathway or intrinsic pathway? A very important mnemonic that you have here is the two opposite emotions, happy and wept. Remember, happy and wept are our mnemonics to remember this. What does happy stand for? With heparin, you need to monitor APTT and it is intrinsic pathway. With warfarin, extrinsic pathway, it is PT which is monitored. The PT increases. So remember this very important mnemonic which is happy and wept. So heparin is APTT intrinsic, warfarin is extrinsic and PT. Now my next question to you, which is an INICET exam question as well. Which factor, oh I wrote it here, I actually wanted to write here on this slide. So which factor is exclusive to the extrinsic pathway? Extrinsic pathway exclusive coagulation factor is which one? Extrinsic pathway, which is the one which is extrinsic pathway. I've told you the mnemonic for that also in short, pan India short we have discussed. Extrinsic in the heaven, outside the world, in the heaven is factor 7. So remember, it is factor 7, very, very important. The tissue factor, factor 7, very, very important, right? So this is factor 7, which is extrinsic. Okay, factor 7, which is extrinsic. So remember, when we are talking about increased PT, that means indirectly we are talking about this factor 7 deficiency. The clotting factors are synthesized where? Where are the clotting factors synthesized in our body? They are synthesized in the liver, hepatocytes, and that is why damage to this hepatocytes will affect the clotting factors, and that is why, do you not see with liver failure increased PT? In obstetrics also we have discussed, when there is the liver failure in pregnancy, it is going to lead to increased PT-INR. Do you not read in cirrhosis वाला grading जो system है? Cirrhosis के लिए कौन सा होता है? CTP score. The child took Turcotte score जो होता है, right? You have in that PT-INR. So you know that liver failure leads to increased PT, and that is why when you connect the dots together, it's going to be hepatocyte injury. Endothelial cells, rather the damage to the endothelial cells. Remember, damage to endothelial cells, Furchow's triad, vessel injury, endothelial injury, it leads to hypercoagulability. Okay, rather it leads to hypercoagulability. Okay. Clear with everyone? So this is how you need to integrate and apply everything which you will learn only with the MCQ practice, right? So it is not that whatever you are reading, like one subject has to be exclusive to that subject. You have to apply it in other subjects. Where have I read about increased PT, right? Liver failure, cirrhosis, so hepatocyte injury. Okay, hepatocyte injury. Correct. Going to the last question here. This is your last question in the fast 5 for today. This is a short question. 30-year-old woman has polyhydramnios. The esophagus is normal. So which of the following abnormalities is the likely cause of polyhydramnios? Now understand, for amniotic fluid, again something we have discussed in short. Amniotic fluid, after 20 weeks, the fetal urine is contributing predominantly to amniotic fluid. So if there is oligohydramnios, you think of renal agenesis or any obstruction, urinary obstruction is going to be oligohydramnios. When it is polyhydramnios, this fluid which comes out, the amniotic fluid, it is swallowed by the fetus, then it goes in the body and comes out in the urine. That is how it is circulating. So if there is any swallowing problem, that is what is going to lead to polyhydramnios. So swallowing problem could be esophagus problem like esophageal atresia, tracheoesophageal fistula, right, or CDH. Or the swallowing problem could be because of the CNS cause, the brain is not maturing, like in anencephaly, right? So remember, in anencephaly there are multiple causes of polyhydramnios. One, the brain is open, so the CSF goes out. So CSF contributes to the amniotic fluid, so the volume increases. The brain is not well matured, the brainstem, it is not formed, so the swallowing is affected, and that is why again it leads to polyhydramnios. So remember, anencephaly is associated with polyhydramnios, very, very important. Okay, very, very important. And anencephaly, remember, the management for anencephaly has to be MTP. You do not give folic acid for treating anencephaly. Folic acid is given for preventing the neural tube defects. It has no role in treating the neural tube defects. So next time when this female who had anencephaly previously in the previous pregnancy will be given more dose of folic acid, 4 milligrams as compared to regular 0.4 milligram. Okay. So this is for prevention, not for treatment. Remember, folic acid is for prevention and not for treatment. Okay. Endothelial injury, the most important you have to remember is hypercoagulability. Okay, that is for Furchow's triad. Right, so those were the 5 questions here, guys. So quickly revising and putting together Tell me the 5 points that we have learned today. What are the 5 learning lessons that we have learned today? What was the first question for? The deep peroneal nerve is the sensation in the first web space. Okay, very, very important. What was the next question that we had? PCOM aneurysm is an important cause of third nerve palsy. Okay, PCOM aneurysm is an important cause of third nerve palsy, where you have dilated pupil, ptosis, down and out eyeball. What was the third question that we had? What was the third, fourth and fifth question that we had here? Yes. What was the third question that we had? So aneurysm, then you had the third one, which was amenorrhea, then you had hepatocytes wala, and then you had anencephaly wala, right? So amenorrhea is a finding in pituitary lesion, pituitary adenoma, because of the prolactin increased. Pituitary adenoma will have bitemporal hemianopia. Next, PT increased in hepatocyte injury, right? Liver failure, because the clotting factors are not synthesized. Okay, and the last one was polyhydramnios. Remember, anencephaly is an important cause of polyhydramnios. So I hope this has given you a quick insight into how, when you also solve the Q bank, the custom modules, the PYQs, how you have to convert every question into just this one-liner flashcard that you have to revise later, right? It's much easier to revise this one page of for 5 questions rather than doing the 10 pages ka slides, right? So guys, start doing this. Whatever questions you are solving, convert them into one-liner flashcards like this. The key points that I have to remember from every question. Okay, that is what you have to understand. Yes, clear with everyone? The tissue factor activates the extrinsic pathway, right? And for everybody who joined late, I've also given you the timetable for the INICET TND that we are starting. Everybody, you should give the first mini GT, which is going to be on 8th of September, that is day after tomorrow. These tests, the mini GTs are going to be free for everybody, not the discussions, but the test. Okay, so you have the mini GTs here, the 4 mini GTs, 50 questions, 45 minutes. Like I said, the first one I'll keep it relatively easy. That means you should score good in that. Okay, and then we will have 3 subjects combined test based on the timetable, the targets that I have given you. And for the students preparing for FMGE and NEET PG, you have a separate timetable of your targets and your live classes going on, where again in the live classes we discuss a lot of PYQs is what we are doing first. PYQs of FMG, PYQs of NEET PG, and some PYQs of INICET also. Okay. Okay, Vash is asking, took SureShot subscription today, and how can I effectively use SureShot to improve my GT scores? See, basically, first thing you complete from the Medsynapse app is the Pan India SureShot, or if you are following the timetable, you go according to subject wise. When you start the subject, you first do the SureShot, the Pan India SureShot. Okay, then you watch the binge, and then you do the MCQ discussion videos, right? All the videos are very, very important. Whatever has not been covered in Pan India SureShot, the PYTs that has been covered in binge, and then you learn applying all that theory to MCQs with the MCQ discussion videos. Okay, so I'm reorganizing the content subject wise. Currently I've done it for 4 subjects, the ongoing subjects: physiology for INICET students and microbiology for NEET PG students. I have organized the content for you. And the next ones, that is dermat and anesthesia, the INICET students starting anesthesia and finishing anesthesia tomorrow. You have the anesthesia folder available in reorganized content wala folder, so you can watch anesthesia from there only, right? I've removed all the extra videos which are not required to be watched. So the surplus video tells you the main video extra topics which were there previously. How to integrate Medsynapse with first aid? See, whatever topic you have, like biochemistry, whatever subjects you want to do from first aid which are must do, so you can watch a video a YouTube video which has been put by Vibin, the last year student who got All India rank of 202. He has very well described that how did he combine Medsynapse and first aid together, and for which subjects did he do that specifically. So I think you would learn it the best there. Okay, so for the subjects that he was focusing on first aid, how he combined both of them in one book, you'll get to learn there. All right, so please do watch his video. No, it is not at all lengthy. शर्मा जी, अगर आप इसको lengthy बोलोगे ना, इससे कोई shortcut और कुछ नहीं मिल सकता. Remember, I cannot teach you in a way where I just tell you the facts. I believe in clearing the concepts as well. So, because that is what gives you an extra edge in the exam. So, please watch the videos to clear your concepts. Right? Okay. ठीक है. सब कुछ हो जाता है. This is not much to do, right? So इतना तो आपको करना ही करना है if you're looking for a good rank. Right, so that was about this one, guys, and that was about the INICET timetable that we had. The next live class that we are going to have is 10 of September, where you will have these three subjects: dermat, physio, anesthesia. And then we will have 12 September microbiology is what we are going to have. Right, so that's the plan, and we will have the mini GT discussion, at least a part on 11th of September. Okay, 11th September we'll do the mini INIGT of 8th discussion on 11th. Okay, clear with everyone, and we are going to continue with this F3 with N3, the fast 5 Friday fast 5. So every Friday you will give a test, just 5 questions, and we will discuss it. Except of course for the days when I am traveling or due to some personal commitments, I'm not able to take a class. For that day, either we'll do a class on Thursday or Saturday, but we will do it. Okay, so fast 5 every week is what you are going to have. Vesh, you can ask the doubts via mail, Telegram, Instagram. You can tag me on my Telegram group as well. You have multiple ways, right? Okay, chalo. Thank you so much everyone, and goodbye, take care. And keep studying, keep revising, keep Medsynapsing, and keep winning. Thank you so much. I'll see you on 10th in the Medsynapse app for the subscribers for the INICET TND, the first one. Okay. Thank you so much, everyone.